name is Dr.Jarred Oduor. I'm a medical doctor in Kenya. I currently work with the Kenyatta University Teaching Research and Referral Hospital as a medical doctor. I'm a Merck Foundation alumni. I pursued the one-year diabetic postgraduate diploma in diabetes at the University of South Wales. The prevalence of diabetes in Kenya is currently estimated at over 20% of the population. The same for hypertension. However, nowadays we find that we are having increasing number of cases of diabetes and hypertension, particularly in the young population. Previously, we used not to expect to have diabetic cases in the youth and even pediatric patients, but nowadays we are increasingly finding new cases. However, in Kenya we have a huge shortage of diabetologists and cardiology hypertension specialists. Despite the rapidly increasing cases of diabetes and hypertension, the acute shortage of specialists has actually hindered the provision of quality healthcare to diabetes patients, and that one has precipitated the rapidly increasing cases of diabetics-related complications, either microvascular or macrovascular complications. I've been equipped with valuable skills that have helped me to properly manage my patients. Particularly, I'm now able to detect and diagnose cases of diabetes in early stages. Besides that, I'm able to properly educate and advise my patients on what they can do to prevent their progression or to properly manage their disease. In addition, I've been able to prescribe appropriate medication to my patients. Besides that, the skills that I gained and the knowledge have allowed me to be able to modulate the patient treatment depending on their disease progression. I've had the opportunity to train community health workers and community health volunteers in my village and equip them with appropriate skills that has enabled them to properly screen cases of diabetes in the community as they are doing their rounds in the villages. And this has proven to be very valuable in detecting these cases at an early stage and thereby helping members of the community to be able to find treatment at an appropriate stage before they start developing any form of diabetics-related complications. I was able to learn of some courses or some clinical practice that have not yet been practiced in Kenya. Majorly, we find there are some special kinds of diet, such as the Mediterranean diet. We normally don't practice that in Kenya. I will highly encourage my colleagues at work, or both at work and in other professions also, to pursue the one-year postgraduate diploma in diabetes, because you find that this program, there are some special skills that one gains when they pursue this program, and these skills you'll not gain them while doing your undergraduate or postgraduate course in either nursing or medicine or even dentistry. You not gain them. The institution acknowledged me when I received the one-year postgraduate diploma. They moved me to the medical outpatient department, where majorly I deal with the cases of hypertension and diabetes. Basically, we are the people now who run those clinics in the hospital, and this has proven to be very valuable in allowing me to properly utilize the skills that I got and help my community appropriately. I would like to thank Merck Foundation for this, providing me with the opportunity to pursue a postgraduate diploma in diabetes. I would like to urge them to continue offering these opportunities to Kenyans, because we still have a huge shortage of diabetes, more so as the cases of diabetes and hypertension is rising rapidly in the population. Continuing to provide this, offering this opportunity to other doctors in Kenya to pursue this one-year postgraduate diploma in diabetes will prove to be quite instrumental in increasing the number of diabetologists in Kenya, of certified diabetologists in Kenya, who will help the country to achieve its, we call them Big Four agenda, which includes health and the Vision 2030.